Hello and welcome. Now before we dive in, just wanted to let you know that this explainer is based on a chapter from the book Maze Madune Maze Niantran. If you want to know more, please do visit schoolfordiabetes.in. All right, let's get started.
You know, there's a kind of tsunami happening in India right now. But it's not made of water. It's a silent, slow-moving wave. A massive health crisis that is growing into one of the biggest challenges our country has ever faced. We're talking about diabetes.
And just look at this number. It's a projection, but it's a scary one. By 2030, as many as 1 in 4 people in India could have diabetes. Let that sink in for a second. That means pretty much every family in the country will be affected in some way. This isn't just a number, it's personal.
So what happens if things don't change? Well, after just 10 years of uncontrolled diabetes, the risks are huge. We're looking at a 20% chance of a heart attack, a 5% risk of kidney failure, and a 3% risk of going blind. These are serious, life-changing consequences that are happening to real people.
So that brings up a really big question, right? We have all this amazing modern medicine, all these advancements. So why is this problem getting worse, not better? Where's the disconnect?
Let's think about it from a personal perspective. If you or someone you love has diabetes, you know the drill. That 3-month checkup. But have you ever stopped to think about what really happens during that short visit?
It pretty much always boils down to the same 5 sentences, doesn't it? Show me your reports. Okay, take these pills. Try to avoid sweets and fried food. You should walk 5 kilometers every day. And finally, pay the fee, and I'll see you in another 3 months. It's a rinse and repeat cycle, but is it actually solving the real problem?
And here's the real heart of the issue. Our medical system is brilliant at what we call acute reactive care. You break your arm, they fix it. You get an infection, they give you an antibiotic. But diabetes isn't like that. It's a chronic, long-term condition. It needs proactive management day in and day out. We need to move from a system that's all about the doctor to one that's all about the patient.
So if the old way isn't working, we need a new way of thinking, a completely new philosophy. And that philosophy is all about the power of self-management.
This quote just says it all perfectly. You see, diabetes is fundamentally a lifestyle disease, and you can't get a lifestyle change from a pill bottle or a prescription. It can't be made in a factory. The real change, the effort that actually matters, has to come from you, the individual, living your everyday life.
And that's exactly what we mean when we say empowerment. It's not about being told what to do. It's about gaining the knowledge and the skills you need to feel strong, to feel confident, and to take back control of your own health.
Okay, so this idea of empowerment sounds great, but what does it actually look like in the real world? Well, let me introduce you to a practical solution that's making this happen. It's called the Baramati Pattern.
The best way to think about it is like a diabetes school. Seriously, it's a structured program that gives people the education and the tools they need to manage their own health. And the best part is for absolutely everyone. It doesn't matter if you're a rocket scientist or a farm laborer, because diabetes doesn't care about your job.
So what do you learn at this school? Well, it's not just theory. You get real knowledge about your condition. You learn practical skills for managing it every day. They train you on how to use the tools, how to read the charts, and they give you a modern scientific way to think about it all. And this part is so important. They involve the whole family, because this is a team effort.
So what happens when you put all of this into practice? What does the future actually look like? Well, it's about so much more than just managing a disease. It's about a whole new vision for what health can be in India.
I mean, just look at this transformation. On the one side, you have the before picture, a patient who feels dependent, who doesn't have all the information, and whose main strategy is just taking pills. And then look at the after, a confident, happy person who's totally in the driver's seat of their own health journey. It's a night and day difference.
And the results speak for themselves. People's lifestyles improve, their blood sugar stays in a healthy range, and most importantly, they can prevent those devastating long-term complications we talked about earlier. It even helps the whole family stay healthier, and works for other types of diabetes too.
So what if we changed our entire goal as a nation? Right now, people call India the diabetes capital of the world. But what if we flip that on its head? What if we decided to become the world capital of well-controlled diabetics, a country that proves this challenge can be met and mastered? Now that's a vision worth fighting for.
And that leaves us with one last, really important question for you to think about. When you're dealing with a lifelong condition,
Who is the single most important member of your entire healthcare team? Is it the doctor, the specialist, the pharmacist? No. The answer is you.